Turning now to the coronavirus. The House passed an $8.3 billion emergency funding deal today.
That's right. The news comes as California confirms its first death, bringing the death toll in the U.S. to 11. Today's funding package more than triples President Trump's $2.5 billion plan. About $2 billion of that will go to federal, state, and local governments. The Senate is expected to vote on it later this week.
And today, Governor Ralph Northam reassured Virginians the Commonwealth is prepared. Northam says state officials began planning in January within days of the virus surfacing. A team made up of public health and safety experts is in daily contact with the CDC. They are working to make sure first responders, hospitals, and healthcare providers are ready.
Governor Northam also said that Virginians should not panic, but take this seriously, warning there's a lot of misinformation out there about coronavirus and its impacts.
And that was actually the topic of a discussion at Eastern Virginia Medical School tonight. 10 on your side's Brett Hall was there, and as experts were trying to bust myths, what was the reaction?
Well, there were a lot of people that were, wow, I didn't realize this, and there's a lot of information still out there leading people astray, no matter how accurate the information going out is. For example, one of the many questions asked tonight was, is it true that certain races are more at risk than others for contracting coronavirus? I saw that on social media. That was the question. And it was met with a resounding no.
Doubling down on the facts about coronavirus, officially known as COVID-19.
There's a lot of misinformation going around on social media. It's really sad, actually.
It's why EVMS held this well-attended panel tonight. Doctors, emergency management planners, and even economists weighed in.
World Bank estimates something like this could cost $570 billion.
Some of the information presented was far from comforting. Dr. Brian Martin with EVMS says unlike concerns in the last decade about swine flu and Ebola,
when you have the ability for the virus to jump from person to person within the community, then that becomes much more or much less able to be contained.
But he also says it's important for people to know that of the thousands that have contracted coronavirus,
About 49,000 of those people had been treated and released. And so this is not a death sentence.
as with many other illnesses, the greater your age, the greater the risks. Another misconception is that you should automatically avoid larger events for the time being. One person asked if there was a chance for the upcoming Something in the Water Festival to be canceled.
We're not at that point yet of making a decision of whether or not that specific event or others would be canceled.
The largest takeaway? It's on all of us to take precautions to prevent the virus spread.
All about recognition and source control. That's what they said. And there's a lot more we could have brought up tonight. A lot of great resources online right now for you at wavy.com. Just go to the news tab and click on coronavirus. Brett Hall, 10 on your side.